everybody. Welcome to the newest installment of the Curling Educational Series brought to you by the Curler Outreach Program. We're very excited to have you here with us tonight. And we're also excited that we have a few doctors in the house to discuss a very relevant, very important topic these days, COVID-19 and curling, how it affects the game, and maybe some implications for the future. So before we get started, I will launch our curling demographics poll, which also includes some additional questions on location and club operations and so forth. So if you could take a few moments and answer those questions, we greatly appreciate it. All answers are anonymous, so we don't know who's answering what. And in the meantime, we'll go ahead and get started with the presentation. I know we sent a disclaimer in the email with the Zoom link, but we also just wanted to remind everybody, this is a respectful space. The purpose of this webinar is to present information for all of you to, hopefully learn a little bit more about COVID-19 and its effects on curling, and also to make educated decisions amongst yourselves. Obviously, I am not a doctor. We do have two different doctors in the house tonight, but you should consult your own healthcare providers about any specific concerns relating to your own health and your day-to-day activities. So just so you know, this is purely informational. We're not going to tell you exactly what you should do. So please keep that in mind, and please keep all dialogue civil and respectful. We will have Q&A at the end. We do ask that you remain muted for the bulk of the presentation. And the presentation will be kind of in two parts. The beginning will be talking specifically about the virus itself, COVID-19, and kind of how it works and mechanisms for transmission and things like that. And then in the second part, we'll transition to kind of how the virus relates specifically to curling, its effects on the game, outbreaks, and maybe some pointers for future operations. So with that, I will introduce our guests. First off is Dr. Paul Luethy. You may have seen his name. Those of you who read the report from the U.S. Curling Club Nationals COVID-19 outbreak. He was the author of that research paper, which is pretty darn cool. We hadn't seen anything else like that in our sport. So we do thank him very much for taking the time to be with us and for offering his expertise. He is the Associate Director of the Clinical Microbiology and Virology Laboratories at the University of Maryland Medical Center, and an assistant professor at the University of Maryland School of Medicine. So very highly qualified to speak about virology and microbiology for sure. And the second person that we have here today is Dr. Joe Gorz, who is a board certified family practice physician, currently located in Lake Orion, Michigan. And he graduated from the Michigan State University College of Osteopathic Medicine in 2013. So we're very happy to have you here as well, Joe. And finally, we have Mr. Don Powell, a level 4 championship ice technician for Curling Canada. He's based out of Ontario. He's made ice for countless events around the world, as well as Briars, Scotties, Slams, you name it. And fun fact, that figure that you see behind Don in that picture is actually Brad Jacobs, who took an ice technician course and is flooding in the background. So fun little fact for you there. And Don also owns Iceworks Curling Services, which is an ice technician consulting service. And with that, I think we will transition into the main presentation. So we'll switch over to Paul's presentation here. Just a moment, we'll get that going. And I will go ahead and hand it over to Paul. Thank you so much for joining us, and also to Joe. There we go.
All right, okay, I couldn't get the bar to come down that unmuted myself. It was like hiding up there, and then all the Apple bars were coming down, and
bars everywhere.
Yeah. All right, thanks so much for having me. So yeah, we're going to talk about COVID-19 and curling. And we've got Dr. Gorz and Don Powell. Thank you so much for coming on, both of you, to help answer questions. How I kind of envision this is like Stephanie said, the first half of the talk is going to be about kind of COVID and how it spreads and kind of some prevention strategies. And then we're going to transition that into how does that fit into curling and how has it affected curling? And then kind of ending on the topic everybody wants to know about, which is what's going to happen or what are happening over in Canada with the Scotties Brier worlds. What are they doing and what do we know and how can we apply the principles that we know that work well to those. So first slide is a disclaimer, my own too. Standard stuff. It doesn't represent the University of Maryland School of Medicine. Also does not represent the board of directors of Potomac Curling Club or the thoughts of Potomac Curling Club. And then, like Stephanie said, this is not the opinions or necessarily the views of the Curler Outreach Program, the USCA, WCF, or the other curling governing bodies. So just kind of starting with how's it going and how it is now. This is a graph showing new confirmed COVID-19 cases per day normalized by population. So if we were just looking at normal cases, the USA would be way up here on the top of the thing, but this is normalized by population, so it kind of shows a perspective there. As you can see, we've got the United States, the European Union, and Canada. So we were okay way back in a year ago, almost. It kind of increased, and we're seeing these bumps that occur over the summer, and then we've hit recently the holiday bumps, and so you've got your bump from Christmas and your bump from New Year's. So we are coming down, but cases are still very, very high. COVID is still very prominent. Deaths are still very high, so it is still something that is still very concerning. So how does COVID spread, and why is this continuing to happen? So there are three main forms of coronavirus transmission. The one that everybody probably thinks of the most is the one that is the way that the flu really spreads, which is by fomite transmission. Fomites are contaminated objects or surfaces that you touch with your hand, and then you take your hand and you touch your eyes, your nose, your mouth, and then you get infected that way. And so the best way to prevent fomite transition is hand washing and using hand sanitizer. And that was kind of the first prevention method that was put out there back a year ago when COVID-19 first started. The second form of transmission, and probably the most dominant form of transmission, is droplet transmission. So these are particles that are expelled from your mouth while you're speaking or breathing, coughing or sneezing. So if you've ever seen one of those videos of someone sneezing in slow motion, you've seen all those droplets come out of their mouth. You see it looks really gross and it's spreading everywhere. So those are what they mean by droplet transmission. So these are large particles, relatively as far as size, that carry the virus, and they can spread the virus to your nose, your mouth. You breathe these in, they maybe get on your face, you touch them, you rub them on your eyes by accident. And there are several precautions that can be taken for this. The one that we all know about, of course, is social distancing, so staying 6 feet apart. And that's because these droplets, they're large, and so they're heavy, and so they fall very quickly. And so staying 6 feet apart is a way to prevent having these land on you. But even better is wearing masks. And we'll get into that a little bit later, but masks, when you have them and wear them appropriately over your nose and over your chin, these stop these big particles from coming out. They get caught in the mask and they don't go out into the air, and they can't go then hit somebody else. Other methods of prevention would be eye protection. This is a method to protect yourself, wearing goggles or a face shield to stop the splashing of the particles around your face, and then staying outdoors so that these particles disperse in the air. They don't have a chance to get to 6 feet to you because the wind blows them around. And then finally, the third method of transmission, and one that was really discovered kind of over the summer and has become more and more accepted, is aerosol transmission. So aerosol transmission is tiny particles or tiny droplets, much smaller than the droplets that you would get out of a sneeze, that can come out when an infected person exhales, especially when shouting, singing, speaking, or breathing really heavily due to exertion due to heavy exercise. Aerosols are mostly inhaled as the means of transmitting the virus. And unlike droplets, as this graphic says in the wording there, they're small, so gravity doesn't pull them down right away. And so these can stay suspended in the air, and air currents can then blow these around and distribute them through enclosed indoor spaces that are poorly ventilated. So prevention tips for this, we've all heard this: wear masks, stay 6 feet apart, staying outdoors, and then ventilating really helps for these, having those open windows and open doors. And we'll talk a little more about that too. All right. So sometimes it can be a little confusing then, if you're in a situation where somebody was sick and maybe they sneezed on you and you got exposed, what can be the timeline? What happens to the way that someone gets infected and eventually tests positive? So it's important to know that COVID-19 incubation timeline can take up to 14 days before someone develops symptoms and tests positive. So here's an example from the New Mexico Department of Health in the United States. So day 0, this individual is exposed to COVID-19. Maybe it was at work, or maybe they were at a restaurant. And a couple days later, she learns that either a colleague or someone she was there with was positive. And so she does the responsible thing and self-isolates. And then the next day gets a COVID test and it comes back negative. Now it's been multiple days since she was exposed, and she is, very happy she's negative, as we all would be if we came back with a negative test. And so she unknowingly, thinking that she doesn't have COVID-19, goes to work and to a small family gathering. But unfortunately, she was actually infected, and the virus is incubating inside of her, and she wasn't yet showing symptoms. And so what this means, she was exposed to the virus. It was building up and growing inside of her, and it wasn't yet at a level that the COVID test was able to come back positive, because it was still below the limit of detection for the COVID test. So she goes to this work gathering and family gathering, and she's contagious at the time. She's now exposed to 11 people. And then 2 days later, she develops symptoms and gets a COVID test again, and is now actually positive. And here are the symptoms that are included for COVID-19. And it's important to note that you don't have to have all of these symptoms. You may have one of these symptoms or multiple of these symptoms. But these include fever or chills, cough, shortness of breath, fatigue, muscle aches, headache, loss of taste or smell, sore throat, congestion or runny nose, or diarrhea or vomiting or nausea. So that's the typical situation that we're seeing right now, where somebody is exposed and there's a incubation time between 0 and 14 days. And then they might expose someone else once they become infectious. So here's another kind of illustration that Dr. Gorz and I had kind of talked about and wanted to illustrate about how COVID-19 can spread between personal bubbles. Because while we're sitting at home and we're doing, only essential activities, we kind of think that, I'm very safe. I know that my bubble is very compact. I have lowered my risk, and usually we do, but it's important to remember that, even any time that we open our bubble just a little and share it with somebody else, it can lead to a potential for infection. So let's say that this green bubble right here is your bubble, as appropriately named, with your bubble right there. And you decide that, let's say it's mine, and I decide that I want to go see my sister. And so now my bubble is now shared between my bubble and my sister's bubble. We had a family gathering. Let's say it was over the holidays, and we saw each other, and that was that. Well, the important thing to remember is that unless my sister was just staying at home and going out for essential activities for all of her precautions, now that we're sharing bubbles, her bubble that she interacted with this person is now in my bubble, and her bubble of that person that interacted with this person could now potentially be included as part of my bubble, until you get eventually to somebody here is illustrated in the red bubble as someone who's infected. Well, they've shared the bubble with this group has shared their bubble with this group has shared their bubble with my sister, and now my sister has shared her bubble with me, leading to the risk for myself of having an exposure of infection. So that's how easily it can spread between personal bubbles. So when should someone get a test? And this is according to the USDA CDC. These are the current guidelines for testing people who have symptoms of COVID-19. So any of those that were listed there. Anyone who's had a close contact for 15 minutes or more with someone who's been confirmed to have COVID-19. And they make an important point to distinguish that it's not 15 minutes at a time, but it's 15 minutes combined over a total of an entire day. So let's say you're at work and someone is infected and you stop in their office for 5 minutes, and then you go about your day, and then a couple hours later you come back and you spend 10 minutes in their office. Well, now that's 15 total minutes that you've been around this person. And the reason for this is that you're increasing your exposure to concentrations of the virus that they may be emitting at that time that increases your risk for infection. Other people who should get a test are those who have taken part in activities that put them at higher risk for infection because they cannot social distance as needed. Examples include travel, large gatherings, crowded indoor settings, and then finally, if your healthcare provider asks or refers you to go get a test. And then the CDC recommends, while you're waiting for tests, make sure you quarantine and self-isolate as recommended. So testing is kind of my big thing, so I couldn't not include some slides about that, but I think it's also good to clear up what are some differences about the different testing. So there's really three types of COVID-19 tests out there. There's a PCR test, there's an antigen test, and there's an antibody test. And we'll talk about each of those real quickly. Importantly, PCR and antigen tests are really a snapshot of the moment when you're tested. So if I'm tested today by a PCR and antigen test, these two tests only reflect my current status today. So if I'm not infected today and I get a negative test and maybe it takes a couple days for the results to come back, and say I get it, let's say Sunday. So I get it on Tuesday, all it says is that on Sunday, my test was negative. Now, if I get exposed and in the future, let's say Wednesday, I develop symptoms and my test is then positive, it's showing the result from Wednesday when I was tested. So there was some time between Sunday and Wednesday where I may have been infectious. So PCR testing, it stands for polymerase chain reaction. It's the most sensitive method of testing. It's really cool because it uses some really fancy technology to check and detect viral genetic material. So this is the DNA and the RNA of the virus, very, very small particles in very, very small amounts. Unfortunately, this testing can often be expensive and take a couple of days for the result to come back, especially right now as we continue to have issues in the laboratory with materials and having supply issues. However, it still continues to get better as businesses are able to ramp up production, so results are coming back faster and faster. These tests, they can be collected either of just like the front of your nose, you can do saliva, or it's nasopharyngeal swabs, which are the swabs that go all the way to the back of your nose. People describe them as poking your brain. They're not that bad, but they are pretty far back. Importantly, with PCR testing, if you get tested and you're positive and after you recover, you may stay positive with a PCR test after you've recovered from COVID-19, as it's still detecting small amounts of RNA that might be there. Doesn't necessarily mean that you're infectious though. All right, antigen testing. So antigen testing uses nasal and nasopharyngeal swabs to detect viral proteins, antigens. So you're looking for the protein now rather than the RNA or the DNA. These are fast. So when people think of like going to the minute clinic or to the urgent care and getting those quick tests, like a quick flu test, they take, usually they're an antigen test and they're fast. They're about 15 minutes and they're relatively cheap. This is an example of what one might look like. You kind of put like a drop of liquid here after sticking the swab up your nose and putting it in some liquid, and then it wicks up the paper that's in this test. And if these lines go up here, then it means it's a positive test. One of the drawbacks of antigen testing is that they're less sensitive than PCR. And this is because they are required, or because of what they look for really, right? So PCR, it's looking for the DNA or RNA, and it's doing it in a method where it continuously looks and can boost the signal over time. Whereas with antigen testing, you're looking for a certain amount of protein that's there, and if it's more of a is it there or not there, and it has to be at that certain concentration to be detected before it will be positive. So these are still under development. There was a report from one that was recently released from the CDC as evaluated by that group, and it was much more sensitive in a symptomatic individual, so someone with maybe loss of taste of smell and a runny nose and cough. That was about 70–80% of those were positive. But if people were asymptomatic, it was kind of a coin flip of whether or not they could be detected if they were positive at that time. And then just ending on that, like if you do have symptoms and your doctor, this is something to talk about with your physician. If it's negative, they probably will want to get it confirmed by PCR testing because it is much more sensitive. Finally, we have antibody testing. So antibody testing is a blood sample to detect antibodies to COVID-19. So this really what it tells you is, did you have exposure or did you have a previous infection to COVID-19? So antibodies, right, are the byproduct of your immune system fighting back the infection. And so they produce these antibodies to help them fight the infection. And so these tests, what they do is they look at for the presence of antibodies and whether or not you have them means that you did or did not have the infection potentially in the past. It is unknown how long these antibodies last. However, there is newer evidence that has been published suggesting that antibodies may confer some immunity if you have antibodies from a past infection. All right, so these are all the different ways, that it spreads and how you should get tested. But how do we go about protecting ourselves? We kind of talked about it, but how do we go about protecting ourselves from exposure to COVID-19? And I really like this picture. It's from, you can see down here with the credit, it's from virologyDownUnder.com from the artist, and it's called the Swiss cheese respiratory virus pandemic offense model. And really what it is no single intervention is perfect at preventing spread. So wearing a mask, prevents some spread, but the small particles that can get through the masks, those are the holes in the piece of Swiss cheese. And so you can see this piece of Swiss cheese labeled for masks, and the virus can get through that. So the point of this model is that it shows that there are multiple layers that are both personal responsibilities, such as staying home if you're sick, physical distancing, masking, washing your hands, don't touch your face, don't go to crowds, as well as then shared responsibilities like having a good testing setup, increasing ventilation maybe in the building or workplace that you're in, as well as vaccines are included as additional pieces of cheese to help stop the virus from getting all the way in from here, as it shows on the left, to the individual. So distancing is easy. I'm not going to go over that too much because, again, it just keeps you away from the droplets. But I wanted to talk a little bit more about masks and kind of show and ventilation and show good pictures of why these work, as well as because then they provide a baseline for what you can use in a curling club. So masks, again, you want them to cover your mouth and your nose to block the release of the big respiratory droplets that contain the virus. And by proxy, these droplets contain other microorganisms that just live in your mouth. And we'll look at that here in a picture in a second. Masks are effective at blocking the large droplets. They are some evidence that the multi-layer mask can block small droplets that result in the aerosolization, but really masks are for those big droplets. And then there are further studies, again, showing with those small droplets that multi-layer masks may help filter some of those out before you breathe them in. And so this is where you may have heard the saying from the CDC and from the other kind of groups that wearing a mask is meant to help and protect others. And now because it stops you from putting out those big droplets. Well, now there's some evidence to show that it helps protect yourself as well. Masks have been shown in CDC studies that prevent infections where there was an infected individual. Example would be in a hair salon, a Navy ship was shown, long haul flights, hospital systems. So they are shown to have been very effective. This is a really nice picture from a friend of mine, Dr. Rich Davis. He's at Providence Sacred Health Medical Center. And what it does is it shows how respiratory droplets spread. And so this is agar plates. These are plates that bacteria grow on. And he showed that on the left without a mask and on the right with a mask, what happens when you do normal activities and the droplets they produce, these big droplets that spread at least 6 feet away from you. So he showed when you sneeze, you see all these little dots. These are all bacteria that grow in your mouth normally. And so this represents all these little droplets the bacteria came on. And so you can imagine each of these little drops could potentially be a drop carrying a virus as well. And so you see sneeze contains all these droplets that could spread, and he held these away from him from 6 feet. Singing, you can see when he sang for a minute at a large volume, so shouting, singing, still released droplets, so you're seeing bacteria. Just normal talking for a minute, still had droplets as well. And then 2 coughs, he had 2 big plates here, and he showed the 2 coughs from 6 feet away carried a pretty large amount of droplets, resulting in growth of bacteria from those droplets. But when he put a mask on, it's really striking what you see. Sneezing, nothing. All you're seeing is the writing of the marker on the back of the plate. Singing for a minute with a mask on, nothing. Talking for a minute with a mask on, nothing. Coughing with a mask on for two coughs, nothing. So these really big droplets really do get stuck in the mask, and I really enjoy this presentation because it does such a good job of showing that. There has been some thought about masks and using them for sport, about how they affect oxygen and CO2 levels. And it's really important to say that masks do not actually affect these at all. So here's a study on the left that was published in JAMA this year, where they looked at participants before wearing a mask, and they looked at their oxygen levels while wearing a mask, and they looked at their oxygen levels, and then after wearing a mask, and they looked at their oxygen levels. And you can see all of them were in the 96 point something percent. There's really no change. Masks do not stop oxygen from getting in and out. A good analogy that I like to think of for masks is trying to think of them like a furnace filter. So air still throws through your mask. The oxygen and the CO2, they still get through your mask just fine. But these masks and the filter, what they actually do is they require more energy to move the air through the mask or the filter, right? If you don't have a mask on, it's very easy to breathe. But if you have a mask on and you're running or you're doing physical exercise, it seems, you've probably felt like it's harder to do that. And that's because it is. It takes more energy to move the air in and out because of that layer there. And it's the same as the furnace filter. You put a thicker furnace filter in, it takes more energy for your furnace to move that air through it. But at the end of the day, the principle holds the same. It's just the oxygen and the CO2 are still coming out at the same levels, but it's just requiring more energy. So very important thing to think about with masks. All right, filtration and ventilation strategies. So droplets can spread via air currents, as mentioned before. And we want to think about large droplets versus small droplets. So large droplets, again, these are the ones from sneezing, from coughing, that land 6 feet and get pulled down by gravity. But if there's a boost of air, they might be able to help them go a little farther, but generally they fall pretty quick. But those small droplets that aerosolize and stay suspended in the air, these can stay and travel around the room. And so here's a nice picture published in Clinical Infectious Disease, where you see these little circles represent the virus, the particles containing the virus. It's concentrating as this infected individual here at the door continues to talk and shout to the person over by the window. And so they're spreading more and more and concentrating more virus. And the ventilation in the house is working a little bit to take some in and out, but it's not working great. So this is why outdoor activities versus indoor activities get brought up so much. In outdoor activities, you have a huge volume of air where there's wind and other air currents that can pull the infected particles away. And so you don't have to worry about those as much. Whereas in indoor activities, you're in a sealed environment, ventilation's not so great, and the air continues to fill up and concentrate the amount of virus that's in the air. So you can increase ventilation by opening windows or venting in fresh air, and that's where this picture shows. You've opened a window, fresh air is coming in, diluting out the virus. Virus particles are flowing out the window, and they've also increased the ventilation. So maybe they turned their furnace fan on or something like that. And so you can see virus is getting sucked up out of the ventilation in the big arrows. So it's been running constantly versus small ones where maybe it only runs every once in a while. And you can also use higher grade HVAC filtration to capture the smaller particles inside of your furnace filter as the air is circulated. So we know now, this is kind of the end of the first half there, where we've seen, how virus spreads, how we are doing right now, what are the prevention measures. So let's talk about things or areas where the virus has spread and outbreaks that have been studied and what we've learned from those. And then we'll get into how curling is very similar and what we've learned from the curling outbreaks. So Restaurants tend to be one of the main culprits of spreads of infection. And so this is a study from earlier in 2020 in China, where they had a restaurant, and you can see three tables up here on the top, and then two additional tables on the bottom where families were sitting at them. And in this situation, individual A1 that's highlighted in yellow, they were infected. All of these other people were not infected at first. And so you've got this air conditioner here, and it is blowing air across the tables. And I don't have the extended diagram, but these blow, and you can see that it would blow across table C, across table A, it would hit the wall. There would be some exhaust from the exhaust fan, but knowing some aerodynamics and stuff like that, you can imagine it would bounce off the wall and they would come back and recirculate through the air conditioner. And so that's exactly what happened. It blew across table A, and the individual who was eating and talking there, it blew their infected particles across table B, infected those individuals there, bounced them back around the wall, concentrated them in this airflow at this top of the room, where all of these other individuals highlighted in red circles were infected just by this one person being in the same room. Air currents can also affect spread in outdoor dining. And I'm going to see, does this work? Yes. So I'm going to show this YouTube video Dr. Gorz sent to me.
Paul, did you want to share the audio from the video as well?
Is it not going across?
No, you have to select share audio as well. Sorry.
That's okay. So basically, I guess I'll just narrate it. So what they're showing is that you're sitting in an outdoor tent, and here you've got airflow going because all the walls are open. And so while you've got the ceiling, the airflow is still bouncing around because all the walls are open. But now that you've added walls, it's showing that you're blocking the wind, and now it's kind of becoming more like an indoor situation. And so it's circulating, it's concentrating on the inside. And they go on and then show, since we don't have the audio, I'll stop it there. They go on to show, like, if you're in like an igloo situation, it really is much more like an indoor area, and you lose that benefit of being outdoors. So even though you've tried to be good and be outdoors and do that, you have to be cognizant of the ventilation and the airflow that you have there. All right, close that. Restart this. Okay, so that is restaurants. Let's move into other ice sports, specifically hockey. So there's a really good study published on an outbreak that happened in Tampa Bay, Florida in June of 2020. It was believed that one player infected 13 others, either on the ice or while they were sitting on the bench during the game, or while they were in the locker room. And there are many reasons why the doctors and researchers behind this study believe that this virus spread so easily at this game. First off is the heavy breathing. So as you breathe more, you're expelling more droplets, you're expelling more virus. And of course, hockey is a very aerobically intense game. And so you're going to have lots of heavy breathing. And so the infected individual released a lot more virus. Hockey, there were no masks used in this game. And so people who were sitting on the benches were exposed without masks to stop those droplets from coming out, as well as to not help them. They weren't wearing masks to help protect them. Hockey rinks have limited airflow indoors. You know, it's a big space, but there's still limited airflow, as well as limited airflow in the locker room. And so these were important areas where they thought factors for spread. And then there's a recent hypothesis from air engineers that ice rinks, like hockey rinks, may capture air just above the head level due to the gradients of air, where it's colder on the bottom, so the warm air kind of rises at the top and is enclosed with those plastic and the wood walls, the plastic or the plexiglass windows and the wooden boards. And so they think that this potentially also could have caused a risk to the players as they were expelling, as the one infected individual was expelling a lot of virus out into the air. Furthermore, there's studies recently kind of trying to understand how well the virus survives at low temperatures and low humidities. There was a study actually 10 years ago that looked at animal coronaviruses, so ones that are related to COVID, but not necessarily COVID. And they saw 10 years ago that these survived at low temperatures. They looked at 4 degrees C, which is 39.2 degrees Fahrenheit, as well as low humidity at 20% relative humidity, and found that it survived very well on surfaces. And there's a preprint that came out last year that shows the same thing. So this graph figure is from that. So 10 degrees C, so not quite as cold, but a nice temperature of an ice rink that we're used to maybe in curling or in hockey, as well as a relative humidity of 40%. You're seeing the decay of the virus over time, over hours from 0 to 100 hours. It's very slow compared to really warm temperatures or high humidity where the virus dies very quickly. And this is on plastic surfaces, not looking at droplets. So there still is a lot of data that needs to be shown there, but it does show the potential for the virus to survive in those situations. So let's get to curling. And we've put this together in the chronological order of events that we know about. So really the first one that happened was the USA Curling Club National Championships that happened at the Potomac Curling Club in the week of March 7th through 14th last year. If you guys don't remember that week, that was the week that pretty much everything shut down. That Wednesday was the Wednesday of that week where Rudy Gobert in the NBA tested positive, and then everything kind of snowballed from that. It was a week-long tournament, men's and women's, 10 teams for each men's and women's, representing the 10 regional associations. These aren't the associations, but these are the states that the 10 different teams came from. So we had people from Alaska, Arizona, Colorado, Illinois, New Jersey, Minnesota, Michigan, Wisconsin, Washington, and North Dakota. At the time, this was before we really knew anything about COVID. And so we were doing the best that we could based off of what we knew for flu prevention. So we did a lot of surface cleaning, we removed shared food, drink containers, making sure everything was like a single use. So like a granola bar in a single use wrapper or a single use cup, that sort of thing. We encouraged broom and elbow taps instead of doing the traditional handshakes. We canceled the opening banquet, and we had a very limited closing banquet that we tried to make as distant, socially distant, and as limited as possible. Unfortunately, if you haven't heard the news, there was a big outbreak at that event. So following in the summer, there's a lot of interest from myself as well as a couple others in learning what happened and how much did it really spread. And USA Curling was totally on board with this. So I really thank them for that. And I thank all the participants from the study, both the volunteers, the officials, and the players, as well as some spectators too that volunteered to provide information of what happened. And so if you're looking for this report, I'll just say it's available on the USA Curling website, as well as it's on a preprint server, medRxiv, for those who might be interested in reading it. So we had 187 participants and 159 responded. So we got a great sample size. 55.6% of all participants experienced COVID-19 symptoms. So quite a bit. When you break it down by players, compared to officials and volunteers and spectators, the players had the highest percentage experienced symptoms. Fewer volunteers did at around 33%, and then about 63.6% of spectators, which maybe is a little high, but it's because there were much fewer spectators, so the denominator is a little lower. As a result of this exposure, we learned that there were 4 hospitalizations from this event. So it wasn't just people getting a runny nose and a headache. It was very serious for some of the participants who were there. Of those who were there, 19.8% tested positive by PCR, 35% eventually tested positive for antibodies. Again, when all these tests were done, it was much earlier in the year. So a lot of testing wasn't available. So if those were to be done now, we imagine it would be much higher, but it was to show that there were true confirmed positive tests. Here's a figure that was put together just showing the number of symptoms by participant type. Again, the symptoms are over on the right that we assessed, and you can see that it very much varied. There were many people who were asymptomatic, but then there are a lot of people who had 1 symptom up to 10 symptoms, with the majority having 5 or 6 different symptoms. all of those that are listed here. So it isn't just a single symptom or a certain prevalence of symptoms, it's a combination of symptoms. We assessed how long it took for those individuals that they had those symptoms, as well as how long it took to return to normal activities. So on the left, we have it broken out by volunteers. Oops, that keeps popping up. By volunteers, by players, alternates, or coaches, or by spectators. And so this is a violin plot. And you can see at the time of this study being performed, if it's all the way up here at the top, this meant that they were still experiencing symptoms at that time. So there were several people who still 150 days or more out from the event in March were experiencing symptoms, but majority had symptoms anywhere from a week to 2 months of time. And then for those who were able to return to normal activities, so this was, your state of normal before the tournament took place. You can see that it also varied as well, and it went from just a couple days all the way up to there are many people still who were not back to normal, including just from anecdotal talking to a couple of people that they still some were missing loss of taste and smell, or were still having issues with their aerobic capacity or something like that. And then finally, this chart is a time plot kind of demonstrating the amount of time and exposure time that individuals had who ended up being symptomatic. So on the left, you can see blue boxes mean people who spent a day there. So each blue box means 1 day, and each then number is a person. So person 29 was only there for a day, but they ended up developing symptoms. Person 1 was there for almost the entire week. But the trend for this is that those who spent more time at the event ended up developing symptoms compared to those who did not spend as much time at the event. And these are just for volunteers because we didn't show the players, because the players is pretty much almost a solid blue block for those who develop selling symptoms, because they were all there every day, right? So it's not much to look at in comparison. But in summary, what this figure shows is that more exposure you have to the virus, the more likely you are at risk to develop infection. Other events that then started to happen, there was a bonspiel in Alberta where there were a lot of healthcare professionals during March, and there were 12 of 47 healthcare professionals that tested positive following the bonspiel. In this news article, it said that many saw patients afterwards, resulting in what is referred to as, they referred to in the article as a contact tracing nightmare. So that was one other event. And then it was kind of quiet for a while. And then in, I believe this was late October, USA Curling came out with a press release about there were 3 clubs in the United States that had some outbreaks. There were some details that came out of these, such as that some were requiring masks in leagues, others were not requiring masks in their leagues. All of them, though, allowed post-game socializing in some form, and the post-game socializing was indoors without masks on. And the information that was obtained was that spread was seen between teams playing on the same sheet, as well as some individuals who weren't even playing in the same game between those 2 teams, and it resulting of about an outbreak of 10 to 15 people on average in each of these clubs. So that was interesting. And then more recently, there was an outbreak in Saskatchewan where there were large numbers of COVID-19 cases linked to this events in Regina. It was a seniors bonspiel. Masks were required in the lobby, but not on the ice. The lounge was open, albeit with a limited capacity at each table. The rink was closed to the public, the limited number of sheets in play, clean the rocks, clean the surfaces every 60 minutes. Midway through the event, a team pulled out with flu-like illness, tested positive, and then shortly after that, others began testing positive as well. And then finally, and I think probably the most recent, is this Denmark World Curling or World Qualification Tournament for men's and women's worlds. And this really kind of broke with the Rocks Across the Pond podcast, as you can see in the Twitter screen cap right there. And then Devin Haru, who's a reporter in Canada who covers curling, he also reported on it. And really what came out was that they required a negative PCR test 3 days before the competition. Everyone was negative going in. They started playing, and then a player tested positive Saturday evening of the competition. while they were negative the Thursday and Friday before. Ultimately, they stopped the event, and 14 of 16 players ultimately tested positive. And other things that they had, men and women played on opposite sides of the rink, but spread still occurred, and there really wasn't a bubble. But this outbreak still occurred in this small setting. So what went wrong, and what can we pull from that? Well, the first thing is that masks were not required, or were known to be required during play, and we know from the principles of spread and how the masks work that these are important for stopping the large droplets that could come out while you're breathing heavily, while exercising, so while you're sweeping hard, as well as shouting. If the skip is shutting down the sheet, wearing a mask could stop those droplets coming from the skip. A lot of these events had indoor socializing and dining without masks. And we know from studies of restaurants, again, right, that dining, eating, talking, if there's music, maybe you're talking a little louder, these release droplets as well, both large and small droplets, that if it's an indoor setting, those get stuck in, especially with poor ventilation, can result in the infection of individuals. Limited changes to airflow, if any, it wasn't really spoken on, but you can assume, especially at least what we know from the Potomac Curling Club, US Nationals outbreak, we didn't make any changes to our airflow. And then what we know now, perhaps that COVID-19 was surviving more because of the low temperatures and humidity of a curling environment required for nice ice conditions. And so maybe this resulted in optimal spread. So what can you do to prevent this? Maybe your club is paused right now. Maybe your club is thinking about putting the ice in still for the rest of the year. What is there that you can do? Because this all sounds very ominous and awful. And but what can we, what advice can we learn from these situations, and what can we do? So number one, this is paraphrasing from the CDC and from WHO, but the best way to avoid getting COVID-19 is not to expose yourself to COVID-19. So staying out of those situations, and if that potentially means not curling, that what it might be for somebody, an individual, that might mean not curling to them. And then the next thing you've got to do is you got to follow all local, state, provincial for our Canadian friends, and then federal guidelines and requirements. So using the ones that are current for the curling club that I would attend, this is what our requirements are. So our local requirements are that you have to have face coverings. So you'd have to have masks on indoors and outdoors, even when exercising. If it was a skating rink, which they specifically mentioned, you may operate at 25% capacity. There's no indoor dining allowed. And then all the rest says follow CDC guidelines, which if you've been to the CDC site lately, there is a lot to click on and a lot to learn from. And then on top of that, we have our state guidelines that gatherings are not to exceed 10 people. So even though the local says may operate at 25% capacity, you have to consider the gathering limit, that the limit travel to essential purposes only. So the state really is trying to push on that. And then if you do travel out of state into a non-contiguous state, you must get a test or quarantine for 10 days. And so as this screen cap from our club's website indicates, our board of directors made the decision back earlier in the season to close for the year and close for the season, ultimately due to all these guidelines and additional risks that might occur. All right, so let's say your board decides they do want to open. What other things can you do? So masks are probably one of the most important. Again, masks are one of the easiest methods to slow the spread of COVID-19. Depending on your local guidelines, you may have to require masks at all time, but it really is, this is also from USCA guidelines. You want to require masks at all times, including during play. And you're going to want to have policies in place on mask use and misuse, including exclusion of masks that don't work. So this is a nice chart from the CDC where they say, do masks use these that have multiple layers, that are washable, they cover your nose, your mouth, and then don't use masks that have fabrics that are hard to breathe, or don't use masks that have exhalation valves or vents, because these don't stop the virus, they actually allow the virus to come out. As well as other considerations, potentially like what if your glasses fog, and they actually have tips for that as well. I mentioned there's going to be, there probably are rule changes like including masks, and Curl Canada and USCA have both come out with guidelines on how to return to that. So some of these include rule changes like the single sweeper, or having distancing markers on the ice, Again, USCA said that you should have masks on while you're playing as well as anywhere else in the building. And then USCA also says that you should not have any type of indoor socializing or broom stacking inside of the curling club at the time. And this, as we've learned, is due to the fact of the droplet spread and aerosolization spread. Ventilation and filtration also apply to curling clubs. According to CDC, things you can do to increase your ventilation: increase your outdoor air ventilation, open doors, or have your system bring in outdoors air, open windows, use fans to help blow air in and out, run your ventilation system on for continuous fan operation, maybe increase your air system filtration to the highest possible level without severely reducing airflow. They recommend MERV 13 filters. These are thicker filters than your standard furnace filter that trap more smaller particles. But again, as these get thicker, remember, it's that energy argument. It takes more energy to push the air across. And so they recommend you look and work with your furnace group or your HVAC system group on that. And then if you need more filtration, possibly use a portable HEPA filter if needed. And this screen cap is an example from a story at the British Curling Academy, and it's highlighted down in yellow down at the bottom. That as a result of knowing that they need more filtration, UK Sport and Active Stirling Council, they installed new equipment to the National Curling Academy building, ensuring there's 100% fresh air rather than recirculated air within the building in accordance with the new guidelines for building. So this is, really took it to the next level as far as getting in outdoor air and increasing the filtration so that there wasn't circulation inside of an indoor setting. There are going to be ice maker precautions that have to be taken as well. Again, while we have evidence that the virus may survive in colder settings with lower humidity, there isn't any data really to know whether or not it survives directly on an ice playing surface. Unfortunately, in this environment, the national funding bodies don't want to give out money for this. I don't know why. I think it would be something really interesting to do, but I think they have more important things at the moment. But so we don't know exactly, but we can make some inferences that it may survive more well in the curling environments as well as potentially on the ice. One important thing is that when you're scraping off the top of the ice. This may create droplets, which then may disperse while you're scraping. And so there are some basic precautions you want to take. Wearing a mask, obviously, for both the reasons of protecting anyone else who's out there with you, but also to protect yourself. You probably want to wear a face shield or goggles to stop any droplets from getting on your eyes that might come up. You'll want to clean the handles of the scraper down afterwards. And then hand hygiene, of course, is really important, washing your hands afterwards, as it is from any surface touching that we're doing right now anyways. And then the last point, I'll let Don attest to this afterwards when we kind of do a Q&A panel. But it's very likely that these airflow changes that you are likely to hopefully implement where you're increasing your ventilation, these are going to have an effect on the playing surface. And so it's something for ice makers to take into consideration is how is this going to affect the playing surface? How is it going to affect ice quality and what they need to do to maybe counteract that. All right, so club curling in the future. So this is that was the short-term club curling type situation. What's going to happen in the fall is probably the million-dollar question, and it's actually very difficult to predict. And I say that because I say, who thought we would have had a COVID-19 vaccine before the end of 2020? We don't have video on, but I'm not raising my hand. I honestly did not think we were going to make that. But it's been absolutely amazing how quickly the science has progressed with vaccines and with all of the treatment knowledge for this disease. So it's difficult to predict what's going to happen in the fall. So it's more of a question of what types of questions does your board of directors or your executive group of your curling club need to assess as they get into the summer and as the fall approaches. So again, you want to look at what are the local, state, provincial, and federal guidelines in relation to indoor activities. What are the current regulations on mask use? What are the cleaning and airflow policies that your club wants or needs to keep in effect? And then finally, what are the infection and vaccination rates in your club's area? And this is a question I don't know the answer to, but can a club require vaccination to play? These are all things that you need to assess before the club opens again in the fall. Speaking of vaccines, now as we get towards the end here, there are many different candidates that are being used for the vaccine, as you can see in this picture. So they're all coming in different routes of delivery. So hopefully, as we continue to move along and gather more data, more vaccines will be approved, and that we'll have more access to individuals so that we can get more of the population vaccinated, so that maybe we can not have to wear masks while curling, and we don't have to have all these other changes, and we can see more of a normal, what we're used to seeing fall come later this year. Just shortly on the 2 vaccines that are currently available, at least in the United States, the Pfizer and the Moderna vaccine. So these are really cool. These are vaccines that they put a part of the genetic code, the RNA, that tells cells what to produce. So basically what they're doing is they're delivering instructions into your cells in your arm. It's an injection into the arm. And it basically, think of it like a 3D printer. Your cell becomes a 3D printer, it gets the instructions, and it produces a bunch of proteins. It does not produce the whole virus, it just produces the proteins for a certain part of the virus that then your immune system recognizes and builds antibodies and memory immunity to, so that if you do get exposure to the virus later on, your body is able to fight back against infections from the coronavirus. And these are great because it's a really big advancement in technology. They're found to be currently 95% effective at preventing coronavirus disease. Common side effects, we can maybe talk about those later if people are interested, but they include the same thing as other vaccines, like soreness of the arm, maybe some chills and aches. However, it's important to note as vaccines are being given out, and you saw the kind of embarrassing picture of me getting my vaccine a couple weeks ago that they had at the beginning, that we need to make sure we're still wearing a mask, social distancing, and other important infection prevention protocols, even after receiving the vaccine. And that's because we don't really know yet. While we know that the virus or the vaccine prevents infection and infectious disease, we don't know whether or not the vaccine prevents us from transmitting it to someone else. So you still want to be a good member of the community and wear your mask, social distance, so that maybe even though you're vaccinated, you don't give it to somebody else until we learn further if the vaccine can prevent that. All right, so the part that everybody's kind of been waiting for, what about professional events? So we kind of have to think about the difference in club versus professional events to get to how these things work. So in club community events, right, think about testing. Their testing is done at medical tents, hospitals, pharmacies. It's done out in the community. Individuals, they live in the community. They're exposed to personal and family bubbles. They're maybe exposed to, if they have to go to the grocery store, they're exposed to those type of situations. As far as club events, we're not paid staff. We're all volunteers, or if they are paid staff, they're under the same exposures and same guidelines as club members. And they're subject to the infection prevention measures according to local, state, and provincial guidelines. Now let's think about professional events. So testing, hotels, meals, they're often always paid for. There's high budgets, right? Paid for by the sponsors, instead of an individual being responsible for that themselves. Players are isolated as they wait out a quarantine period because they have a hotel available to them, because, like, for example, the NHL is able to pay for that. Similar to club events, though, volunteer staff are subject to strict guidelines to help prevent infection. And then isolation continues, and these infection prevention measures continue, such that masks and other infection prevention measures may not be required in these professional bubble events. So what made the NHL bubble work? Players were tested multiple times per week prior to arriving at the event or at the bubble they were at. They were tested then daily after arriving, so that there were no escape. If they were in the incubation period, there was no escape of a potential positive person who was there. And then importantly, on top of that, while they were waiting out that incubation period, they were only allowed exposure to their travel group that they came with during that first week after arriving. And then further, they kept teams isolated to floors or to buildings or arenas, so that teams stayed together rather than mixing with different groups. And then they inquired that all players wear a mask at all times when not playing to help prevent the spread. Now we're seeing right now with the NHL, it's transitioned back to something more of like somewhere in between a professional and club event. So you're seeing these people out living in the communities. They're going to the different areas while having the benefits of advanced testing and other materials as well. So that's where we're seeing, for example, the Dallas Stars had a huge outbreak where I think it was like 15 or 16 players were all affected or infected. And so they've had to push their season back because they're not in a perfect bubble anymore. All right, so the Scotties, Brier, Men's Worlds, Grand Slams, the curling bubbles, what do we know? And this is all from what's been published via reporters in Canada and other news sources. So testing, we know that the players must show proof of a negative COVID-19 test within 3 days of arrival, and that these must be PCR tests. They are then tested on arrival, and then I believe I saw somewhere that they're tested during play, but I don't remember how many times. As well as many symptoms and temperature checks throughout the events. Isolation and quarantine, it's suggested that the players isolate as much as possible 14 days prior to the event, and then travel as direct as possible, whether that's while driving or between home and to the airport and to the host hotels. There's personal rooms, but they can meet with their teams in rooms. So it's kind of similar to that NHL bubble part where they could meet with their travel groups and just stay with that group. And then meals must be inside of the hotel. They can't go outside and interact in the environment to other meals. What are the potential risks from this though? Because this is a little different than the NHL. So the testing on day -3 and day 0, it may not detect an asymptomatic or a pre-symptomatic individual prior to competition. Again, remember it's a 14 potential day of incubation. So if someone were to come in with a potential negative, hopefully it won't happen. It's potential for a risk of that happening. They are not requiring masks, as far as I understand, during competition, which does increase your exposure from heavy breathing, but masks are required elsewhere. So again, it's just a thing that raises the risk, not saying it's going to happen, but a potential risk increase. And then dining indoors, as we know from all the studies, does increase the risk of exposure and infection 2 to 3 times based off of these CDC studies. So again, it's just, I'm hoping very much it does not happen, and they do have a very good setup. It's just important to understand there are potential risks that could occur, just like there are in everyday other events that we're seeing as well. So in summary, curling rinks could be an opportune environment for COVID-19 to spread due to the low temperature, low humidity, and low airflow. Measures to prevent COVID-19 infections include masks, increasing your ventilation in your club, as well as not having indoor socializing or dining. The vaccines are effective, safe, and they'll be really important for future reopenings. And that professional sports bubbles are safer, but some design still has its risk. There is no zero risk event. And so it is something that hopefully will go off without a hitch, and we'll all be able to enjoy watching curling again.
Wouldn't that be a thing? Oh, it's been so long. Thank you so much for all of that information, Paul. It's a pretty comprehensive slideshow. So I think anybody, obviously there's been information, floating around for months and months, throughout all of this from multiple sources, but it's really nice to have that all condensed and to have the visuals as well to help illustrate some of the mechanisms of transmission and the airflow particulars and whatnot. So thank you. And I want to circle back because I know we got some questions in the chat. Some going way back to earlier in the presentation about COVID specifically. On the slide where you had the sort of the Petri dish experiment with the mask, there are a couple questions relating to that. One being, do you know what kind of mask or masks they were using or covering for the side where the droplets weren't getting through?
Yeah, he was just using a cloth mask. Either okay. It was one that you might see just as a cloth, like a surgical mask, like a yellow or blue one, or he even tried it. He didn't show it on the pictures, but he did say he tried it with like a cloth mask you might use for everyday life, not a surgical mask, and that worked just as well.
Okay, yeah, because I know obviously we have N95, KN95, the P2.5 filters that you can put in. That's actually what I have for my cloth masks. because they have a pocket for filters as well. So obviously there's a lot of variation, but that's good to know. And regarding testing, I know you said that the antigen, the rapid tests are potentially not so sensitive. So the accuracy may be a little bit lower than the PCR test. Do you know what the actual sensitivity number or sort of accuracy number would be for the PCR test as opposed to the antigen? How much higher?
Yeah. And Dr. Gorz, feel free to chime into what you've seen personally. From the raw data that we see in the lab, we're seeing a accuracy of 95% or higher.
Okay. So yeah, significantly increased compared to the rapid test. Okay. Do we know, and I don't know if this has been out anywhere, but is there information as far as maybe the reinfection rates among people who have already had COVID or have had confirmed presence of antibodies in their system?
Dr. Gorz, you want to take that one?
Yeah, let's get Joe in here.
The data on that isn't fully out yet. We do know that people do get reinfected. We are seeing about a 3-month, 90 to 180 days, but people are getting reinfected. So just because you get infected does not mean that you are free and clear. You are immune.
Okay. Yeah, I imagine there'll be more and more data on that as time goes by and we have more time to understand it and a larger sample size probably. For the Club Nationals event specifically, you showed that there were some, not a majority, but there were some the folks who got it were kind of the long haulers or had symptoms at least for many months afterwards. Was there a correlation with age with that? Was it primarily older participants or volunteers that may have had symptoms longer, or can you speak to that at all?
If I remember correctly, it did not correlate. There was no statistical significance between age. I believe the 4 people who were hospitalized tended to be older. They were more of the elderly population, but for the long hauls, I believe it was pretty evenly distributed. Joe, what have you seen from your practice?
It's across all ages, and it's your comorbidities that are going to go with it. If you're a smoker, you have a higher likelihood to have an post-COVID bronchitis. That's going to follow this through. If you have underlying health conditions, there is a chance that you're going to have a post-COVID syndrome. Whether that's sleep disturbances, elevated heart rates, we've seen people with arrhythmias, we've seen lung issues, we've seen people that have perfectly healthy lungs that are using inhalers now. We've confirmed it on PFT testing. And some of these things are lasting for months afterwards. So it's not just the initial effect of I'm getting sick, I'm off work. It's some of these things are carrying on 90, 180 days later and could be permanent.
Wow, that's scary, at least from my perspective to think of. What was the other question? Oh, on filtration, I know there's many types of air filtration systems out there, the portable things you can get, a little Honeywell or whatever, air filters you can put from room to room or larger filtration systems. Some of those have, they tout UV filtration technology. Do we have any indication that that's more effective than filters without that? Or purifiers, I should say.
Looking at UV technology, there's some great things there. There's some that don't have the protection that should be there, and you really got to be careful commercial versus public use. In the hospitals, we've been using UVs to sanitize rooms for years, but we're talking $20,000, $30,000 units.
Right.
The things you're picking up at your corner, buyer beware. Yeah.
Understood. Okay, good to know. Sorry, I've seen that everywhere online and in stores and stuff, and all these sites that list all these different air filters. So yeah, I was curious about that, and I see somebody else brought that up too. And has there been any effort that we know of to collect information, and this is curling specific, from open curling clubs with low to no COVID transmission, to look at sort of like best practices, what they've done, what's worked to prevent outbreaks within the clubs?
Not that I'm aware of. I know USA Curling has just kind of asked for if you've had an outbreak at your club to let them know, and that's how they had that press release. But otherwise, so what you've been doing, I think, has just been anecdotal if you've been able to find out from somebody else.
Okay, gotcha. That would be interesting to see long term what the numbers kind of look like. Obviously, there are a lot of clubs. I think I saw from the poll, I think there are about 25% of folks that responded that their clubs are currently open and operational. Yeah, it looks like about 25%. So I know for me personally, our club is operational. We're back to playing in leagues again after some time off when everything got shut down. I think in late November. So we'll see how it goes. But knock on wood, we haven't had any issues with transmission between players on the ice or anything. So that's probably a good sign. Now, moving forward, obviously, we've seen that there are new variants of the virus showing up on different continents. For Paul or for Joe, do you have concerns about those new variants showing up and if that will decrease immune responses for people that have either built up immunity through contracting an earlier variant or through getting vaccinated?
So there's some terminology here that I want to kind of be clear on and try to.
Sure.
We're talking about variants. I'm wearing a blue shirt right now. Imagine if I'm wearing a yellow shirt or a red shirt. You still know it's Joe or Dr. Gorz. Now, a mutation would be me with red hair, maybe a different color skin and different color jacket, something totally unique and is morphed into something else. So variants, I'm a little less concerned with than mutations. Both have their place and both should have concerns. I hope that kind of clears it up, and I hope that analogy helped a little bit. Paul, if you have anything you wanted to add to that.
No, I like that a lot. I'm gonna use that now too.
That's fantastic. Sorry, I keep hitting the wrong button when I'm trying to move screens. I keep muting myself. I apologize. I see that Doug asked about your opinions regarding, the point you brought up, and we don't know the answer, about maybe mandatory vaccinations for clubs to allow curling again. Do you think if that were to happen at that point, do you think that's a time when we could maybe forego the mandatory masking, or is that something that's too soon to tell?
One of the things that I want to be clear on is even if we get the vaccination, we don't necessarily know that if we can't still pass it to individuals. And as healthcare providers, and we're telling everyone not to wear masks. And even some of our colleagues, after they got their second shots, are taking their mask off. And we go, hang on. We want to continue to wear the mask because we're not sure if we can be asymptomatic passers of this. Time will tell. And it's coming. That information is coming.
Understood. And there was a follow-up question to your your analogy with the variants with the shirt versus jacket or hair color. So the variants that we've seen in the news that are popping up, in Europe and maybe you're traveling. So do those correlate to just the different jacket color, or are those a different hair color?
Variants are just different like shirts we're saying.
Okay.
And we believe that those are still going to cover the vaccinations we have out. Okay. We're more concerned with mutations.
Right.
If I turn into a talking bear, for instance, or or a talking dog, that is something very different. And that's what we need to be concerned with and wonder, hey, can we fight this? Is this something new?
I think the first thing I would wonder is, what did I eat or drink that turned you into a talking bear? But that's a different conversation to have. And I saw another question. Actually, it's an ice maker specific question. We can get Don in here. I know he's been hanging out very patiently. Don Powell, thank you so much. Someone asked if you might offer your particular recommendations on PPE, personal protective equipment for ice makers or ice crew members, based on your experience.
Well, I think that falls into what has already been said. Obviously, the first thing is masks. And given the length of day that most ice technicians put in at the club, several masks. Keeping your hands clean, sanitize, keeping your surfaces cleaned, trying to limit how many people are actually handling the same pieces of equipment. But I think the most part is to keep your hands clean. Either wash your hands or use hand sanitizer if washing them is not possible. And I'd like to point out also, to go back to one of Paul's slides where he showed the bubbles intersecting. I think every curler needs to be aware that your ice technician is part of all of those bubbles. And I particularly say that to the ice technicians as well, that if your club has not yet put together your back to work protocols, be part of that. Invite yourself into that, because you are part of every curling bubble that's coming through that facility.
That's a really good point, Don. Thanks for adding that. And I wanted to go back to sort of the vaccine portion. So there's a question about when would you be immune, or when would your immunity start to kick in your immune system after you've been vaccinated? And we know that the vaccines are a two-dose process. So you get your first dose, and then 3 or 4 weeks later, depending on which one you receive, the Moderna or the Pfizer, then you get your second dose. Dr. Gorz, could you speak to that?
Yeah, absolutely. So for instance, we know at the Pfizer vaccination, after 7 days after receiving the first vaccination, we're getting about 50% coverage. So it's still a flip of the coin. We're looking at, after the second vaccination, we're hoping between that 90 and 95% effectiveness, which is unheard of in vaccinations, even with some of the ones that are out there. But there still is a chance that you can still get it. When you're vaccinating 100 million people or 100 people, there's still 5 people that aren't going to produce immunity.
Right. So it's a really good percentage, but it still isn't 100%. But that is impressive. This is kind of a legal question. Could a club not let someone in? I know we pose that hypothetically. If a club were to require vaccinations to return to play, could a club do that legally? Could a club be sued for not allowing someone in? Not a lawyer, not going to touch it.
That's a question for a legal professional. Yeah.
Yep. Sorry. I know there's probably going to be a lot of inquiry into that whole side of things, as clubs continue to move to reopen. But I have no idea how that varies, nationally from state to state, or in terms of federal law or Canadian versus US law. I have no idea. Are people experiencing adverse health effects or impacts to the vaccine? Are there situations with people having symptoms of like Bell's palsy, seizures, or even dying from adverse health effects from the vaccine?
I get this question quite often, and I liken it to, if you went for a 10-mile run, you would come back, you'd be tired, you'd be sweaty, you'd be breathing hard. Your body is essentially going for a 10-mile run when this vaccination comes in. It's processing, it's breaking it down, it's figuring out what it is. So there are going to be some side effects. What they're doing right now in the US is they have a thing called VVAX Finder. And anybody who has a side effect, we are categorizing that information and then going to be data mining it, going through, studying it, finding out what's going on. But you can expect a little bit of a sore arm, your body feeling a little down, even a fever. To me, that's a merit badge. That says, hey, I've got an active immune system and it's doing its job. This is what I wanted to do. Same thing, if I went for that 10-mile run, I hope my legs are cramped up. I hope I got some stains and I'm tired, I hope that analogy works.
Yeah, that makes a lot of sense. You're absolutely, yeah, your body has to respond in one way or another, and building up immunity means maybe some unpleasant effects, just like you get if you're exposed to any sort of invader that comes in, cold or flu, etc. What did I see in the chat? Oh, this is actually going back into Don's court a little bit on air circulation in the curling rink. Obviously, that's a big concern with the way this virus is transmitted from person to person. And of course, curling, we like our air cold and we like it not humid. So how can we, sort of mitigate the risks of the virus surviving, but also not ruin the curling ice or keep it as good as possible, particularly in warmer climates, I might add. Thank you, Rob Sinclair, for that question. And Don, what are your thoughts on this?
I think that's an excellent question. And I think the answer is with lots and lots and lots of money. And unfortunately, I don't think that most curling clubs are in a position to do that. If you bring in outside air when it is warm and humid, that will turn into frost. When air currents blow across an ice surface, that leads to sublimation. Really, the only answer to that without tons and tons of money is to prepare the ice for every draw as pebble it to replace what sublimates, scrape what comes off the surface, hope for the best for the next 2 hours.
There you go. And I see that Kara added kind of a follow-up question. If you're building a new facility, and we've had some new facilities go up very recently here in the US in a few different locations, would it be worth the investment and a priority to invest in like a commercial UV filtration system, kind of on the order of what Joe was talking about? Obviously, they're not accessible to most, but in a commercial facility, do you think, we'll be dealing with the risk of, season closures or shutdowns for the foreseeable future? Maybe, 2, 5, or 10 years out. This may be impossible to answer at this point, but it's a really interesting question.
I do not have an answer to that.
Yeah. Anyone? It's really interesting. And I don't know. I mean, Joe, I think you said, like tens of thousands of dollars for a really, top of the line commercial system, right?
Yeah. For years, we've been using them in hospital rooms. As people come out, we put a UV sensor in, and it's 360 around. They're usually 3 feet tall or 6 feet tall, and you wheel them in and you turn it on, and it radiates the entire room. And we keep them in there for a certain amount of time, and then we take them out and go to the next room. And this is pretty standard in most hospitals, and I imagine across the world. Again, you just got to look at the manufacturer, what the data are, what the specs are, and what you're getting. I'm not a tech guy, so I'm not sure.
Fair enough. So the answer is maybe. We don't know. And I know, what I've seen in more recent kind of news stories and things coming up lately and Joe, Paul, feel free to jump in on this, but it seems like the consensus is sort of becoming that we're going to be dealing with this virus or some variant thereof for the foreseeable future. It's not just going to disappear. It's going to perpetuate, in one form or another. And we may have to, like the flu, where we get our vaccinations every year and it changes a little bit. We may see that same pattern with this. So it's hard to say what the effect will be on curling specifically, I suppose. But it's a really good question. And I think it's one that anybody who's building a club, if you have the dollars to put in a top of the line ventilation system, it may well be worth the money. Hard to say though. And there's another question, and I might direct this at Joe and Paul. Do you have suggestions for specific resources that people should look at to help them make informed personal decisions about getting vaccinated? I assume the CDC would be one of them.
Yeah, I think going on the CDC and I think talking to your physician, one of the toughest things, and I caution everybody on, is there's information everywhere. We open a newspaper, turn the radio on, podcast. You need to pick one or two sources and run with those sources. If you pull a little piece from here, a little piece from there, that can be dangerous because we're not getting the whole picture. And just make sure they're reputable sources. Make sure it's not someone, that's just writing a blog, that they're citing their sources and where they're coming from.
Good advice. And do we have any other questions in the chat? I know there were some, I saw Amelia, I think, shared a link to kind of an interactive site where you can look at the sort of the relative life of the virus estimated in different environments based on humidity and temperature. And I don't know, Paul, I don't know from any of the data you've looked at, do we have a definite number as far as how, or estimation as far as how long the virus could survive in the cold air of a curling rink?
There's been some data, like with the older viruses, like when they, in 2010, when they compared it to some of the animal coronaviruses, those survived for days in the cold environment. So it can be for up to a very long amount of time.
Okay. Yeah, that is a long amount of time. At what level, in your opinion, at what level of community spread would you think it would be ill-advised to have a club be open and operational from a community health perspective? Could you put a number on it?
I think that's a hard question.
Yeah,
that's a difficult question. I don't know if there's a perfect answer for that.
Yeah, and obviously it varies from city to city, community to community, quite dramatically too. I know we talked, there's been a lot of talk about like the percentage positive tests, in areas and where we'd like to be, ideally below maybe 5% or something, but right now we're at 9 or 10 from, in certain areas. So yeah, I don't really know how you quantify that. I guess it's a matter of what your board feels comfortable with. After having those discussions, like you suggested in your presentation, there's a lot of factors that you need to have discussed openly to come to an educated conclusion. What did Nicole share here? What was some research on environmental healthiness of indoor spaces? Interesting. Thanks for sharing that resource, Nicole. I think what we'll do too is all the links that we have for these different pages, we'll share them along with the presentation afterward so that everybody has access to all of them. They may get lost in the chat as well. But Nicole shared a link for a calculator for survival in given temp, humidity, UV conditions. I know there's also an interesting site that I've seen. It's microcovid.org. I don't know if any of you have seen it, but it's kind of fun. You can play, and they've updated it based on the newest data from the variants that we're now seeing. But I don't know, some very bright people put this thing together, and you can plug in your location, different activities, your estimated time doing the activity, how many people are involved, et cetera, and kind of gauge relative risk based on all those parameters. I think we'll share that too. It's really cool. And I think it was quite a collaborative effort putting that together, but that's something that may be useful to folks too. So we'll have all these resources together for everybody so you can check them out and get as much information as you can. Lauren's got a question about people using CO2 monitors to estimate ventilation effectiveness. Do the COVID-19 carrying particles or the aerosols behave enough like a CO2 molecule for one of those monitors to be a useful metric in assessing the air quality or your ventilation efficacy? Do we know?
would say no, but I'm not sure.
Yeah, I'm not entirely sure either. CO2 is atoms, right? So it's
Right.
atomic level versus small droplets that are half a micron to 3 microns in size. So it's a huge, they're very large sizes. So I'm not sure. Yeah, I guess that's the answer. I'll stick the same answer as Joe. They're different, but I don't know the information for that out there.
Fair enough. And Paul, I'll direct this one to you. Do you have a theory as to why the officials at the Club Nationals event in Potomac, why there was a lower degree of infection for them as opposed to like spectators and volunteers? Obviously, they were also out on in the ice shed, I would imagine, with the players too, and moved in and out between the ice shed and the warm room area. But what are your thoughts on that?
I think it's probably a matter of exposure. So there were some officials and volunteers, as we saw on the chart, the heat map chart, that were there for a large chunk of the week, and the bigger the exposure they had, the more likelihood they were to develop symptoms. And so we know that with a bunch of the officials, because I know a couple of them personally, they were only there for a couple of days, maybe at the beginning or for a day or so at the end. And so they had a lower exposure, and that could be a reason why they did not develop symptoms.
Okay. And I see another question in the chat for Dawn, specifically from a junior ice tech who's hanging out here today. For clubs that are currently paused, but hope to come back, what things are there to think about to get your ice back in condition after it's sat? So you didn't shut down for the whole season, you were running, your ice has been sitting for however many weeks, and you got to get back up and running. What's the quickest way to get the ice whipped back up into shape?
What needs to keep in mind is that air and ice interface with each other 24/7, regardless of your curling activity. So without a doubt, there will be some negative impact to the ice sitting dormant for however long. I think what would be required definitely is at least one, maybe two, maybe more flood, and bring the ice back as though it was the very, very beginning of the season with pebbling and scraping.
Good stuff. And I see there's a question about arena-specific ice prep. You know, obviously in arena clubs, you have to deal with hauling equipment out every time if you can't keep it out on the ice all the time because you're sharing with other sports. Any insight on how arena clubs can better deal with that as well?
Wash your hands. Don't touch your face.
Often.
keep the surfaces clean.
Exactly. All right. Well, we've gone on about 90 minutes here. Thank you so much for all of your insights, Don and Paul and Joe. And any last minute questions for these three gentlemen? I think they've done an excellent job compiling and condensing a lot of information. And I hope it's been helpful to all of you. If you have any questions that pop up, maybe after we're done here and you want to ask, feel free to send them in and we'll make sure that you get some answers. Obviously, we're all learning more and more about this every day. So it's a growing process and a long-term learning process. But I think we might be at the finish line, guys. Thank you again so much, everybody, for attending. And I think Amelia or Allison, somebody might have a link to the slide with our upcoming webinars. Please hold. This is where I would insert the hold music if I had the ability, but I cannot. I so wish I could. The most, I guess the one that's coming up soonest would be our mixed doubles webinar. That's next Sunday with Colin Hodgson and Chelsea Carey. We're super stoked to have them with us. They're going to talk about a lot of aspects of doubles play, strategy, tactics, team dynamics, you name it. It's going to be a really comprehensive talk. You can sign up for that at curleroutreach.org. We've got an evening with the ice techs, more ice techs. We're going to bring back Sean Olson and Quentin Way for another ice tech talk, specifically focusing on flat and level ice, getting real intimate with your ice scraper. So that'll be February 7th. And then on the 14th, happy Valentine's Day, everybody. Dave Jensen's coming back to talk about delivery analysis, specifically how to analyze your own delivery, which will be really useful for folks, we think. And beyond that, the 21st of February, the basics of curling webcasting with the godfather himself, Joe Calabrese, and with Brian B.A. Anderson of TESN, the 12th End Sports Network. Those guys have about as much experience with curling webcasting as anybody. They've done a great job, and it's certainly evolved over the years. They will have a lot of insight for anybody, any club that's looking maybe to start streaming games or tournaments or even national events. So that one will be really good to attend if you're interested in that side of things. And finally, February 28th, Dr. Natasha Wesch is returning to talk about a pretty relevant topic, resilience in the face of uncertainty and its challenges, particularly relating to the pandemic and COVID-19. Her first webinar with us was really well received. We think this is going to be a really good one as well. So all of those are available to register at curleroutreach.org. We have the events up on our Facebook page as well, so you can get some information there too. Feel free to email us at curleroutreach@gmail.com or message us on Facebook as well. If you have any questions or feedback, we'd love to hear from you. We're always trying to improve and want to know what everybody wants to learn. That's why we're here, to provide information on a variety of topics related to curling. So thank you all again. And thank you very much, Paul and Don and Joe, for joining us and taking the time to share your insights. It's been really helpful and really enlightening for me, and I hope for everybody else as well. So thank you so much. Have a good evening, everybody. We hope to see you all again soon. Stay healthy, stay safe. Take care.